that we can look at the design and structure of a health facility to make sure that not only patients but also health workers and other visitors to these facilities can be safe. So my colleague Anna is an architect working with WHO. Anna, can you tell us a little bit about your work with WHO? What are you doing on a day-to-day basis, and how does an architect get involved in the COVID response?
Okay, good morning to all, and during our day and during this month we support in a multidisciplinary way with my team, but also with a technical network of universities and other institutions that is called TECNE. We supported many countries in order to provide the best design solution for all the facilities related to COVID-19. So basically we are providing layout and feedbacks to some layouts for facilities related to COVID, like treatment center, but also screening areas, but also self-quarantine areas, and so on.
Okay, and so you're working with something that I've often heard referred to as a help desk. And not only our partners, so for example, UNHCR or UNDP can ask for a request for support, but also ministries of health or regional health actors can come to WHO and say, could you give us advice about how to restructure or change our health facility to make it ready for COVID? Is that right?
Yes, that's right.
And so how many requests has the help desk received around so far?
We received 40 support requests, and if you want, I can show you some data.
Sure. Maybe you can give us an example of the type of design support that you would provide.
As you can see here, we received 40 requests, as I said, mainly from the Africa region, but also from all the other countries. And we support structures for an amount of 3,500 beds. And as you can see here, we are mainly dealing with permanent structure in existing facilities. So basically how to repropose existing facility in COVID treatment center or COVID ward. But also we are dealing with some temporary structure, tents, container, prefab, so it's a very different situation according to this scenario. And just to give an overview of the type of work we do, usually we receive the support request and we work on it in collaboration with our TECNE members. And we provide at the end a technical report with all the drawings, all the diagrams and all the information provided in order to set up the facility and in order to understand the functioning of the facility. So at the end, the final product is something similar to this document. And just to give an overview of the typology of work, mainly we are working, as you can see here, drawing the specific layout according to the situation, because the support we provide is an ad hoc support. Then usually we do also a 3D model. Here I'm showing an example of a treatment center in Burkina Faso that it will be built for COVID, but it should be resilient also to other diseases. And we think that the 3D model is really useful for non-technical people that should understand the functioning and the typology of the space. And after that, as I showed before, here we see the technical report with all the diagrams. For example, these diagrams show the staff spaces in green and the mixed area in red, but also we have some diagrams with arrow to a better understanding of the flows inside the facility. So basically this is the work we are doing every day.
Okay, thank you very much, Anna, for giving us that example of the kind of work that you're doing. So here you've met my colleague Anna, who is an architect, and also my colleague Anya, who is an engineer. You can come over here if you want to, Anya. And we can take questions from our viewers if you would like to understand more about the role of an engineer or an architect in the COVID response. You can ask your questions by using the hashtag AskWHO on Twitter or by leaving a comment in the comment section on other social media platforms. I'll start out just by asking you, Anya, now you're in Bologna and you're working with WHO to help with hospital readiness. I'm curious about your background and where you've worked before coming here to Italy.
I worked before in different epidemics, mostly cholera and Ebola. So in different countries, this is the first time I work actually in Italy. And yeah, I worked in designing and readapting structures for different diseases, infectious diseases in different countries.
You were involved in the Ebola response in the Democratic Republic of Congo, I think, just before coming here.
Yes.
Was there any kind of learning from working on that response that informed what you're doing now?
There is a lot of learning. I think what we applied during this COVID is that, and understanding that also from Congo, is that every country is different. Every town is different, every hospital is different, everything is different. So what we do is really give a support that is built around the context and the facility itself and the people that will use it. So as my colleague was saying, it's like an ad hoc support.
One question that we have from a viewer is, how does WHO extend architectural support to hospitals?
In the case of Bologna, we started supporting an hospital because one of our colleagues was deployed here, and looking at the environment, we start working together to support her. Also on the design part, for example, she went in so many different hospitals in the region here, and she needed support to the design of some different spaces, to the understanding of the different needs, areas, the flows inside the facilities, and so I think that is really important also to have architects in the team, because it's really important to work in a multidisciplinary way in order to take into account while designing to all the different aspects that are inside in such a complex structure.
If I can add, the most interesting part is that we are looking at the same layout with different eyes. So if I cannot see something or if I see it differently, she will complete it, and on the reverse. So we have different views on things, and this is very, very important to not miss anything when you look at the hospital.
There's one project that you've been talking about since I've been here, and that's, you've been referring to it as the hospitals of tomorrow or the hospitals of the future. So some of the learning from COVID you're hoping to not only use today, but to be able to respond to whatever comes at us in the future. Can you tell me a little bit about that project?
So, as you know, COVID took us and shaped us a lot. And people started already think like, so what will the future hospital look like if I have to build something new right now? How will I make my entrance, my flow? What's the ventilation going to be? Are the rooms big enough? Like, what are the new standards? So we were thinking about all of this with the hospital itself, being on the ground and being here to see all the difficulties and all the challenges in the same moment that they happened, helped us to see already. We are thinking about the future, and we are trying to anticipate whatever it can be. Of course, we cannot think of all the possible scenarios, so the answer is that we need to build a hospital that's really flexible to adapt to as many scenarios as possible. it's very complex, I understand, but this is the hospital of the future challenge.
And if I can add something from an architectural point of view, as Anya was saying before, we are dealing in this kind of project. We are dealing, of course, with technical requirements, the ventilation, the materials, and so on. But also, we should always, if we think to the future, we should always take into account all the soft skills and that can contribute for the comfort of patients and staff that in a hospital are dealing with some stressful situation. So we have to take in mind a balance of all the different aspects.
So we have a question from Twitter, and that is for you, Anya. Can you give any specific examples of any design change that was made for COVID-19?
So many. As I was saying before, we can apply a very simple example, the distancing. So before it was the waiting rooms, the waiting areas were really crowded. People were sitting one next to the other. So something that it was done very quickly, it was, you know, those chairs that are all attached one to the other. Now you can sit in one and then you have to measure a distance and then to sit on the other. That's a very simple and quick change that we made like as soon as possible.
Yeah, again, sometimes it's just the small changes that make a big difference. I think we'll probably end here. I wanted to bring it back to Marina, who is joining us, who works at the hospital as a researcher. Just before we end, I thought you could tell us a little bit about your experience here going through COVID. I've seen, and I'm not sure if we can walk closer to it, Mark, but there's a sign, for example, in the background here, and these are all over the grounds of the hospital, basically thanking health workers, and not just health workers, but everybody who's involved in responding to COVID for their work here. So maybe, Marina, if you can just tell us a bit about your experience.
Yeah, thank you for this question. Actually, it has been a very tough experience, as you can imagine, but also we received a lot of support. The medical staff, the health staff in general, received a lot of support, and it was a very nice lesson learned. So in a critic emergency, we could see how other staff, other hospital staff, not usually dealing with infectious diseases, for example, joined our team to work together in multidisciplinary teams, and that was really something that was crucial to deal with the burden of the COVID-19. But we received also a lot of support from the hospital direction, from the health authorities in general, and from the town. A lot of people, volunteers, medical students join us in this effort, and if we could achieve some success in this fight, it's really thanks to a joint effort that was only possible with the support from so many people. Of course, technical support from WHO was also crucial, because they joined us during the preparation and during actually the activities. So it's very important also for the future to count on this kind of support. So we never felt alone in this fight. And this post is just, you can find many of them in the hospital. Everybody wanted to say thank to the doctors and nurses involved in this fight, but actually is a cumulative and collaboration. So I really would like to take the positive lesson from this threat.
Absolutely, and we've heard that from many people that we spoke to at the hospital over the course of this week, that despite all the difficulties, one silver lining, you could say, is how much people have come together to respond to COVID. Yeah. So Marina, thank you so much for your time.
You're welcome.
Thank you to our followers for joining us. I hope it was interesting for you to have the opportunity to hear from an architect and from an engineer about that side of the COVID response. One thing I should say just before closing, we have a few questions about wearing masks outside and why are we doing that today. because we're in a hospital, this whole area that we're walking around is the grounds of a hospital, and there are very vulnerable people here. And because we're close together when asking questions, that's why we have masks on. So thank you very much for following. If you'd like to learn more about, for example, the work of the help desk, you can visit who.int, and the weekly situation reports that we publish often have updates about the work of the help desk. Otherwise, please follow along. Tonight we have a press conference from Geneva that will be live, lots of questions from journalists and the latest updates on COVID tonight on the same social media platforms that you're watching us on now. Thanks very much and have a good day.